Hi everybody, it's David Porter. Today I want to talk about professional ethics for substance abuse counselors, much of which is applicable to other behavioral health professionals. Specifically, I want to discuss confidentiality and the limits thereof. When a patient sees a psychotherapist, whether it's a psychologist, a psychiatrist, a licensed alcohol drug counselor, a licensed clinical social worker, a licensed clinical mental health counselor, or a marriage and family counselor, basically any doctoral or subdoctoral psychotherapist, everything that is discussed is confidential as per federal law. That is HIPAA, Health Insurance Privacy and Portability Act. There are, however, 8 exceptions, and here they are. Number 1 is in 2 and 3. If a patient advises you that they have knowledge of a child, an elderly person, or a handicapped adult, either mentally or physically handicapped adult, being abused or neglected, financially exploited, maltreated in any way, that information cannot be held in confidence. As a licensed behavioral health provider, or for that matter, even if you're a pre-licensure, if you're an intern, or working towards your clinical hours, you are a mandated reporter of child maltreatment, elder maltreatment, and handicapped adult maltreatment. And you must report that you have knowledge of maltreatment occurring to the appropriate state agency, typically Department of Children and Families. You're going to have to contact the 1-800 line and talk to a intake worker and give as much detail and information as you have about the maltreatment, and they take it from there. They decide whether or not it warrants further investigation, but you are legally obligated to report it regardless of confidentiality. These 8 exceptions I'm talking about are legally required or accepted ways, more like legally required ways to circumvent confidentiality. And by the way, everyone, a quick disclaimer: I am a licensed alcohol drug counselor. I am not an attorney, so I have to stay in my lane. I have to keep the discussion within the area of my competence, which is psychotherapy and professional ethics. Any specific cases you have or questions you have regarding professional ethics, you need to speak to an attorney knowledgeable in these matters, and or your professional licensure board, and or for an ethical consult, or a clinical supervisor or peer. Nothing I'm saying here constitutes anything even close to legal advice, because I am not qualified to dispense legal advice. This is information based on my knowledge and experience. So we have exceptions 1, 2, and 3. Exceptions 4 and 5. If a patient is in obvious distress or becomes unresponsive due to a medical condition or possible substance overdose, you cannot hold that in confidence. You must call emergency medical services, 911 emergency medical services, and advise them that I'm a psychotherapist, and in the middle of our session the patient became unresponsive or is in obvious distress. And if you are doing in-person therapy, you get EMS right to your office. If you're doing teletherapy, you dispatch them to the address on file, and make sure you have a home address on file for a number of reasons, including this one. And you can disclose to the EMTs and or dispatch information pertinent to the treatment of the patient. Example: if someone has a history of coronary heart disease, you need to let them know that. And if you must get a patient's med list or list of medications when you are doing your initial intake interview, and let EMTs know their med list. Give them as much information as necessary to help them render treatment, but they don't need any more than that. You have to be tight with the information that you give, but not too tight. Balance is what I'm saying. Okay, so we're up to exceptions 5, exceptions 6 and 7. If someone advises you that they have a plan to do harm to a third party, they are identifying a third party, they are making a threat, they have the means to carry it out, and it's imminent, you are obligated to contact that third party by phone and warn them that there is a plausible threat against them. You need to send this individual, if you have their address, a certified hard copy letter advising them of the threat. You need to contact law enforcement in the jurisdiction of the person making the threat and advise them of what's going on. And you need to contact county mental health in the jurisdiction of the person making the threat and advise them what's going on. Law enforcement and county mental health are for purposes of intervention. And just to be thorough, I also prefer to contact law enforcement within the jurisdiction of the person who is the intended victim, not just the person making the threat. There needs to be intervention, there needs to be protection. The last, and the number 7, is if someone is making threats to do harm to themselves. Oh, by the way, back to number 6, the third-party harm also extends to an individual's property, not just their person, but their property. Number 7, if someone is indicating a plan to do harm to themselves, and it is clear, it is specific, it's imminent, they have the means to carry it out, you need to contact law enforcement in that person's jurisdiction and county mental health in that person's jurisdiction in order to arrange for intervention. You cannot hold threats of harm to a third party or their property or to one's person in confidence. The last one, number 8, is waiver of confidentiality with a specified third party. This is the HIPAA consent form, that is HIPAA, Health Insurance Privacy and Portability Act. There is a form that you give to the patient, and they sign it, date it, print their name, date of birth, and you indicate who this information is going to, why it's being disclosed, basically the expiration date on this disclosure, and whether and what information is to be disclosed. And this is a form the patient fills out more or less voluntarily, and typically it's going to be for their physician. I work with a lot of legal cases, so it's going to be, I typically get HIPAA consent forms filled out for their attorney and for their probation officer, probation or parole officer, or sometimes a family member. You cannot even communicate with someone's spouse unless they sign a consent form. You cannot communicate with their own mother. There is no mother clause. You have to get a consent form. A quick word about people, mandated cases. I mostly see people that are mandated to treatment by the Department of Corrections, and the referral source, Department of Corrections / Parole and Probation, they need information. They need information about the patient, and this is where you get into a gray area. I tell them, and typically they do not want to know more than this: did the patient show up? Yes or no? Are they reasonably cooperative and engaged? Yes or no? How long is this going to take? And that's about all they want to know, and that's about all I disclose. You have to balance between protecting the confidentiality of the patient, but there are cases where you also have to balance that with the safety of the community. The only time I give a PO details about the content of psychotherapy is if I have safety concerns. If someone is talking, again, they're not there yet, but they're talking about harming themselves, if someone is having psychotic symptoms, if someone is having severe medical problems, if someone is drinking and drugging themselves hard. I discuss this with the PO, and it's covered by waiver confidentiality. We're in a discretionary area where, unless otherwise specified on the form, on the aforementioned HIPAA consent form, I am going to be pretty tight with the information, unless I have concerns about that person's safety or the safety of the community. So that is a quick rundown on professional ethics, confidentiality, the 8 exceptions thereof. Everyone, thank you for watching, and please hit subscribe, and be safe.